I've been a veteran service officer for 20 plus years. And I've had in those years, lots of people who come to me under emergency circumstances. They need something, they want something for their dad, their mom, whatever, and they're at their wit's end, and they come to me and they go, "Can you fix it?" And I go, well, none of this is easy, it doesn't happen quick, and we do all the things. So we decided that it's time to just, the folks that want to know what's going on and what's available, we want to get it to you before it's an emergency, before anything that helps you plan. So with that in mind, we have various presenters. I'm going to say a little bit about our benefits, and Nikki is going to speak about what happens here at the Senior Center. We also have somebody, Representative Valerie from Highland Valley. We have Todd Heineck from the VA. We got Jake Hooker from Hooker Elder Law. And we've got Karen from the Arbors. Tina Marie.
She's running a little late, but she will be here.
Okay, Tina Marie. She is an outreach educator for people hard of hearing that use these and like to talk on the phone. Okay, and we've got Greg Kachakian, who's a Medicare counselor and Shine Rep, and we've got Cooley Dickinson VNA Hospice. So all those folks are here. They're all going to do a brief presentation, and then when they're all done, you can then go to the various tables and ask your questions that you have any. You might say, "I know everything," and you want to leave. But you might have a question that's specific to you, and it's fine to go ahead and ask people for them. Okay, so a veteran service officer. I'm supposed to connect the veterans and their families with all the services they might need. We also run a few programs. One of the programs is a financial assistance program for veterans, and they're either their family members or the surviving family members, the spouses, with financial assistance if they're low income. If they've hit hard times, their retirement isn't what they thought it was going to be, medical things came up, other parts of life, and so they don't have the resources anymore and they're living on a fixed income. We have programs. If a veteran or the surviving spouse or family member of a veteran is under 200% FPL and they're on a fixed income, you come see us. We can help you with those medical costs. Even if you're just around the 200%, I don't know what it is right now, but if you're around that level, come see us. We can help pay these medical bills. We can help pay the Medicare bills. We can help do things like that. So if it's a real financial crunch and you're in tough times, we're the people to come see. If that's not your issue and it's just all the other things that are out there, that's why we're doing this, okay? The one thing I would say you can come to our office for when it's up and running and functioning, it is running, and I shouldn't say it that way, but the Holyoke Soldiers Home is now the Holyoke Veterans Home, okay? And as you can see, if you've driven down 91, it's gonna be big, it's gonna be new, it's gonna be modern. Right now, they only have 115 beds that they're actually having people in, and they're full, and they got a waiting list. But it doesn't mean you can't still apply. If you think that is going to be an option for male or female veterans in your family, then go ahead and you can reach out to them, or you can reach our office. And if you're not in one of my towns, then you have a local veteran service officer if you're outside of my towns. I'll say real fast: Pelham, Amherst, Hadley, Northampton, Williamsburg, Goshen, Cummington, Bangor Left, Chesterfield, Worthington, Huntington, Chester, Middlefield, Hatfield, which is a new one. So if you're in one of those towns, you're going to want to talk to us. If you're outside of those towns, you have a veteran service officer, and we can tell you who it is, and you can go see them with that help for the Holyoke Soldiers Home or the benefits program for low income. I have a sheet that kind of breaks it down. So I have some of them up there. I also have the Veteran Blue Book, which was done in conjunction with myself, the VA, and the district attorneys, D.A. Sullivan. Oh, I like that, D.A. Sullivan. Helped make that book. So it has all kinds of different resources for veterans in there, and we've got other things, and everybody's got their display. So I think that's probably my time limit. Again, if you have questions from about those towns or about anything about veteran services, come see us. Next, I would like to introduce the host of our event here today, the Hadley Senior Center, and I'm going to say Nikki LaCorey?
Yeah, you got it.
Nikki LaCorey, please
Thank you.
come up. Thank you, Nikki.
Hi, everybody. I'm Nikki LaCorey from the Hadley Council on Aging. We are primarily a social service agency. Most people don't see us that way, but we are for elders and for veterans, disabled people, and anyone who comes in and needs help, we never turn them away. It's usually a referral, and we send them on their way. We offer services through outreach. Outreach is client finding. In case you don't know, we're all outreach, all services. We all layer into each other, and we're typically the first access point. You come here, you see Lauren, our outreach coordinator, and then if it's a veteran, she'll meet with Dan, who is our local veterans agent, who meets here once a week and part of our municipality, and they work together very well. What the veterans are trying to do is take these layered services and make them one-stop shopping. You come here, you know you got to go to the COA. COA says, you know you got to go to veterans, and then maybe Dan says to Lauren, hey, can you work on this program, and sends them back to the COA. Then, at that point, if it's not veterans or COA, we really refer to Highland Valley at that point if it's outside of our service scope. So with that said, then we move on to Highland Valley, and I believe we're moving on to Valerie, Associate Director of Programs and Services for Highland Valleys. Thank you.
So we have Valerie DeQuisto from Highland Valley to talk about what they provide.
Hi there. I hope everybody can hear me. My voice doesn't carry that far. So I'm Valerie from Highland Valley Elder Services, and I just wanted to tell you a little bit about what Highland Valley is and what we can do. So Highland Valley is a state-funded agency. We are a nonprofit. We're funded both federally and by the state, mostly by the state, to be able to provide in-home services to elders so that they can stay in their homes. That's the main thing that we do, but we do a whole bunch of other stuff too. We have a bunch of different programs aside from the home care program that I just mentioned, where we can put in-home services. And let me just tell you quickly about in-home services. That can involve assistance with housework, laundry, shopping, bathing, dressing. Homemakers can do errands for you. They can pick up medications. We also do the Meals on Wheels. You may be familiar with the Meals on Wheels program. So basically, the eligibility for Highland Valley is very, very open. You have to be 60 or over, and you just need to qualify in terms of having the need for the services. Payment for services is on a sliding fee scale, so nobody is over income. People on Mass Health have access to other programs that may allow them to have up to 24/7 care. For me to go into every single program that we have would take me an hour, so I really wanted to just mention that program. Also mention we have the Protective Services Program. That is where we investigate any allegations of abuse or neglect. So if you or anyone in the community has concerns about somebody, you can make an anonymous report. All of our information is in our brochure. I'm at that back table over there. I encourage you to come and take a look. I can talk much more in depth about what we do. You can make referrals to our services both by the phone and also online. We have a website. So that's it. Okay, thank you.
Thank you. And the Protective Service Program, I've worked with those folks when it comes to housing, and they're really very professional and very good. So if you know if anybody's in trouble, don't hesitate to let them know. This is kind of like, remember when we were all in school, nobody wanted to sit in the front row? And that seems to last throughout our lives. Just youngsters like Stan and, hi Helen, they are up front. All right. I would now like to ask Todd Heineck. He is the VA Caregiver Support Program at the VA. He knows other things about the VA system. I've worked with him for decades and various things. So whatever he presents, you can also go to ask him about other questions as well.
Thank you.
Thanks, Todd.
Thank you, Steve, for inviting me. Thank you for having faith in my breadth of knowledge. So, good afternoon, everybody. Thank you for taking the time for coming out and filling yourself with all of the resources and information about the resources that are available to you today. So Steve's correct. I work for the VA Healthcare in Leeds. My lane within the VA is I work in the Caregiver Support Program. The Caregiver Support Program provides educational and clinical supports to family caregivers of a veteran who is living in the community. So if an individual is a veteran living in their home, an apartment, whatever the home might be, and they have a family member who provides some level of care for them, we're able to provide support services for that caregiver. We recognize and encourage caregivers to take care of themselves, to be able to provide them with educational services to improve their caregiving skills, and to provide them with clinical services to support them along the way. Recognizing that caring for somebody, in our case caring for a veteran, requires a whole team of people, and that the caregiver, that family caregiver, is an important part of that care team. So we encourage them to participate, we help provide referrals to other resources, but really we are looking at, we're the only program that doesn't have the veteran as our identified client, but it's the person who's sitting with the veteran, helping the veteran. That family caregiver, for the purposes of our program, depending on the tier of where you are, can be a spouse, can be an adult child, can be a parent, can be a friend living next door, right? So it's pretty wide and broad. If you have a veteran in your life who you think, I'm helping them do something, we might be able to help you do that better. So look forward to addressing any questions that people have. Thank you very much, Steve, for having me. Appreciate your time.
Thanks, Todd. Well, I do want to mention one of the things that I've had lots of people come up to our office to ask questions about long-term care in the VA. The VA does provide long-term care for veterans that are 70% service-connected or higher. So if you don't know what service-connected means, you're probably not eligible for it anyways, but service connection means that you've got some kind of injury or debilitating condition, chronic condition that was due to your service, whether it's an old war wound or you busted your knee and it hasn't gone away. If you have something where the VA has decided it's at 70% disabling or higher, the VA will provide long-term care, whether you go to the CLC in Leeds, the Community Living Center, or if they pay for you to go to another facility, they will pay for that. They will do that for those veterans. The CLC has a really good nurse. It's my son. His name's Sean, so if you ever have to go there, he's a good guy. A little bit of a plug, huh? Okay, and I'll have more to say about VA stuff in a minute. Now, one thing that's very valuable that we all need to know, he's not going to give you all the answers right away, but he's here to talk with you, is Jake Hooker from Michael Hooker Law Office on Elder Law. Thank you, Jake.
Thank you for the introduction. Hi everyone, I'm attorney Jake Hooker. I work with my father, attorney Michael Hooker. We have a unique law firm. We're elder law specific. We don't do any other kind of law. We just do, talking to the microphone. Can folks hear me now? Excellent. So I'm Jake Hooker, an attorney. I work with my father. We have an elder law practice, meaning that estate planning is a big part of our practice. I'll be talking about that today. Will, power of attorney, healthcare proxy. For the part of today that we'll see if folks are up on their estate planning, who here has a power of attorney? All right, you all get A's. And who here has a healthcare proxy? So that one, everybody's hand should go up. Next time you're at your doctor, that's one that the doctor, you say, hey, I want a healthcare proxy. Can you facilitate that? They have a state form. Just make sure 2 witnesses sign that. And that's super important document, someone to make medical decisions on your behalf in the event you're unable to. Really easy to sign it. If you don't sign one, then your loved ones are in the probate court dealing with a guardianship, a huge nightmare that easily avoided. So go to the doctor's office, sign a healthcare proxy. Power of attorney, very similar, someone to make financial decisions on your behalf. Super easy, you sign this one document and then your loved ones don't need to go to probate court to get a conservatorship over you. Long, expensive process that could be pretty easily avoided by signing a power of attorney. A will, when you die, who gets your estate, that's fairly straightforward. We're big fans of avoiding the probate court whenever you can. The way you avoid probate court is through beneficiary designations. You have a life insurance. When I die, this proceeds go straight to my wife, or joint ownership. You have a bank account you and your wife own jointly. If I die with a bank account just in my name, no co-owner, no beneficiary, it's going to go according to my will through the probate court. That's totally old-fashioned. There's no need to do that. So we're big fans of make sure everything you own jointly, or there's a beneficiary on it, and then your loved ones are not going to be in the probate court processing your will. Makes it a lot easier for them. So that's a big part of our work is estate planning. We also have a social worker on staff. We're the only law firm in the area with a social worker. We also have a Medicaid specialist. So we really deal with the whole aging process. We also serve as fiduciary, that clients name my dad and then me as the backup for their power of attorney or trustee if they have no one else in their world. So we really all encompassing of the aging process. Part of that is asset protection from potential long-term care costs. You go to a nursing home and you've saved up for retirement and then you end up spending it all at $14,000 a month at the nursing home. How do you avoid that? Transfer assets out of your name, or you might be saying, Jake, we're veterans. We'll just go to the soldiers' home. I've had plenty of clients who tell me that, that's my plan, I'll just go to the soldiers' home. As Steve said, there's a limited number of beds. The waiting list is 6 to 12 months. Sometimes they've told clients more than that. So it's really, I caution you against thinking of that as plan A. As Steve said, if you're a service-connected veteran, then over 70%, you can go to a VA contracted facility. You don't need to worry about transferring assets out of your name to protect from potential long-term care costs. But really, it's I want you to get thinking about that. You know, that if the soldier's home is your plan A for, if I ever go to a nursing home, I'll just go there. You know, maybe think about that. It might not be the option you think it is. Still wonderful we have that. Great, the new addition. As if you've driven on 91, seeing that, pretty exciting that they're adding that. So that's really what we do. Elder law specific. That's what we're all about. So come ask me some questions if you have any questions on estate planning, probate avoidance, wills, trusts, power of attorney, healthcare proxies. And then I hope after this, those few hands that didn't go up for a healthcare proxy are making a note to go to my doctor and sign a healthcare proxy.
Yeah, just FYI, it took a while, but we had a long fight with the legislature, and we managed to make sure that there's going to be 237 beds at the new Holyoke Veterans Home. Like I said, currently there's 120 or something, but it is going to go up to that amount when it's all said and done, but we've got a few years of waiting on that. So, and the other issue, and that we've done a lot with, where's my whiz kid? Oh, she's out there. There is a benefits program that the VA provides for all wartime veterans. It's called Aid in Attendance. It is a really good thing if you've got time, you've got effort, you want to fight for it. It's a great benefits program. It helps you pay medical costs when you have to have somebody come in and help you in the home with activities of daily living, okay? They give you money to help pay for that. But it's like anything else, very intrusive. You need to know what money you have, things like that. And also like Medicaid, they now, as of about 6-7 years ago, have a look back period. So if you have a house and you haven't given it to someone, that would count looking back 5 years. So just, it takes a lot of planning. It's a really good program. It gives you money to do it, and I know that it's helped people stay at home much longer, and I've had a few veterans who actually were able to die at home, even though they needed 24-hour care. Between family members and who they could hire, it was able to be done. But it takes a lot of work to do it, and it's not a quick application, so, but we do help with that. Okay, now I would like to ask, speaking of long-term, I would like to ask Karen to come up. I'm not going to try to say her last name because I never do it right, from the Arbors of Amherst. Walter Zucco. Perfect. I was intimidated, but I did it. Thank you.
Hi, thank you everyone for coming. My name's Karen Walter-Zucco, and I am from the Arbors at Amherst, and we are an assisted living, family owned and operated. We've been at the Arbors for 25 plus years, and we offer assistance with, all the activities of daily living, and we also honor our vets and provide a monthly discount to our veterans, monthly discount on rent every month, in a way to say thank you for serving our country. Aid and attendance that Steve was talking about. I have several folks that live in my building, and they receive aid and attendance because we do assist people with activities of daily living. So we have 24-hour staffing coverage in the house, CNA staff, certified nursing assistants. We have nurses in the house, 80 hours a week and on call 24/7. My background is social work, so we have a social worker in the house also. So there's always someone in the house to assist. We provide 3 meals a day, weekly housekeeping, linen change. And the nice thing is we're just a month-to-month rental with a 30-day notice. And we embrace hospice and end-of-life care. We also have a doctor in the house. If you choose to have that doctor become your primary care, you can get care in your own home. And that team is in my building 3 times a week, so it's a great service. We also have a pharmacy that we work with, but if you get your medication through the VA, we can also work with that because we service a lot of veterans in our home. So I have some brochures if you're interested. My business card's in there. You can give me a call, ask me any questions that you have, and thank you again for coming today. Thanks.
Thank you very much, Karen. All right. As I'm going down my list, she was a little late, but better late than never. Where is she? There's Tina Marie from CapTel is going to talk to us about the program she runs. You knew I had to call you out, right?
I'm not from the area. The GPS wasn't bringing me to the right place.
Her husband's name is Matt, so we know where she's from.
Well, they'll figure it out once I start talking a little bit more. Good evening. My name is Tina Marie, and I am here on behalf of CapTel Captioning Telephones. And you might be saying, why is there somebody here for a telephone? Hearing loss is one of the top 3 disabilities amongst veterans. And as I was sitting back there, I saw there are quite a few of you here that do have hearing loss because I could see your hearing aids, as I have hearing aids as well. And so CapTel is a free phone for anyone with hearing loss. There's no age restriction, no financial restrictions. You do not have to be a veteran, but we do have sponsor the Heroes with Hearing Loss program, and you can be a civilian. If you are a veteran and your hearing loss is not service connected, we can still provide a captioning telephone for you. There are 3 captioning telephone companies out there, and you most likely have seen all of the commercials that we all have, and the phone looks exactly like one another. What I can tell you about CapTel is we are the inventors of the technology. We are the only caption telephone, and I'm proud to say this, we are the only caption telephone that is 100% US made. We manufacture the phone ourselves in Madison, Wisconsin, and all of our caption centers are located throughout the United States. We're also the only phone that we actually give you the phone. We're not just loaning it to you. What is CapTel and what is captioning telephones? It's a regular household phone that you can hear on. It's just that it is louder. But if you have hearing loss, you know that louder is not necessarily better. It's also clearer. I can guarantee you, if you have one of the other phones, our audio is far clearer than any of the others because I want you to hear better. And then it captions what's being said. So everything that's being said to you comes across the screen. So if you are questioning what's being said, you can actually look at the screen and read it. It is federally funded. There is no cost whatsoever. You all have already been paying for it on your telephone bill since the early 90s when the Americans with Disabilities Act passed. Oh, excuse me. That ADA, the Americans with Disability Act, passed, and we all started paying a tax on our telephone bill. That tax is what pays for the program. Your hearing loss is the disability that qualifies you for it. I do have the phone in demo mode, so if you do want to come to see it and hear it and experience the difference, please do come over to me. I can have you fill out an application today, and we can come and install it for you at no cost. My mind just went blank. Ooh, okay. So please come over and experience the phone. You do need internet for the phone for the captions. If you don't have a home telephone line, you only have a cell phone, we can now provide a telephone number for you at no cost, so there's no monthly fees. If you do have a home telephone service, you keep your same telephone number, so it doesn't mean you have to get a whole new number. You can keep that telephone number that you've had for 50 years. If you have a phone system in the home, like a cordless phone system or any other phones, you can keep that. This can be in addition to. So please come on over and take a look. And thank you, Steve and Rebecca and Jess and Dan for having me.
Yes, if she's right over there, you can talk to her. If you're not able to reach and get to her today, we are connected. We talk to her all the time. So you can also call our office. There was something about hearing loss. So many years ago when I first started, I had a veteran, his wife called me, and we decided she needed more help, so I went up to do a claim for aid and attendance, and it's 26 pages, and sitting down at the kitchen table getting ready to go through the whole thing, and she goes, "Oh, he wants to come out and say hi." And I said, "Oh, great, I haven't seen him in years." He was friends with my dad. And she goes, "But he's a little hard of hearing." I said, "Oh, all right." So he comes out and he sees me. He says, "Hey, Steve." I said, "Hey, John, how are you?" "What?" "Hi, John, how are you?" "I'm good." "Okay, sit down for a minute." "Yeah." I said, "You have a hearing loss?" And he's like, "Yeah." I said, "What'd you do in the war?" "What do you mean?" I said, "What was your job? What was your MOS?" He says, "Artillery." I said, "What did you use for ear protection?" He said, "Cigarette butts. We'd stick them in our ears." So I looked at her and I said, "We're going to put this paperwork away and we're going to put in a claim for service connection for hearing loss. Usually it's about 10%. He was so deaf, he got 100% service connected for his hearing loss. He couldn't hear a thing, but we screamed across the kitchen table. Lovely man. Okay, and one of our last presenters, man of great knowledge, all about the programs that are out there, your Medicare, all of those things that are available to you. I'd ask Greg Kachakian. Did I say it correctly? I'm getting better at it. Come on up, Greg.
Hi, everybody. My name's Greg Kachakian. It's nice to be here today. It's always good to get this information out into the public because there are always lots of questions when it comes to VA benefits, TRICARE, CHAMP VA. The most common question I get from veterans is, well, how do I make Medicare work with my VA benefits? And it's a very simple solution. The The process has made things a lot simpler for these benefits to work together. In fact, a lot of the emphasis on healthcare for veterans is starting to move out of the VA centers for healthcare. It doesn't mean that you have to move out of the VA from where you get your benefits, but it just means that it's easier to access benefits outside of the VA, and you can do that with Medicare plans. Not all Medicare plans work with VA benefits, or CHAMP VA or TRICARE, but my job is to help fit those pieces together for you. So I'm here today to answer questions about that, but also to answer questions about the new program for medication coverage that just came out in 2025, or that will be coming out in 2025 with the new plans. Things might become more expensive for folks that have prescription drug plans or other Medicare Advantage plans. I'm happy to talk about those things too. But just so you know, for folks that think that they're incompatible with Medicare, VA benefits can fit together quite nicely with Medicare plans. So come and visit me at the table. I'm happy to answer questions and talk more about Medicare. Thank you.
Yeah, I got less than 3 months before I turn 65. I should probably be doing my Medicare, right? Yeah, I don't know where all that time went, but yeah, I'm already making that call. And our last presenter, I would like to have come up from Cooley Dickinson Hospital. I tried to remember to pronounce everybody's name that I didn't even.
It doesn't get any easier than Karen Miller. People ask me to spell it and I say, nope. It's Karen Miller. You have to figure it out yourself. Thanks for having us here today, and it's always good to get in front of a crowd. And I'm used to going last. Hospice generally is considered last in our life, so it's kind of fitting. It's also kind of normal for people to get a little awkward or feel a little somber talking to me about hospice or talking to any of us at Cooley Dickinson about hospice. And it's okay. There's no question that hasn't been answered or asked before, so don't worry. Don't feel awkward. You can ask me anything. A few things about hospice. It's a philosophy. That's the easiest way to start to understand what hospice is. And it's a philosophy that death is a natural part of life. Most of us, if we had our choice, would choose a peaceful passing. Sometimes our body gets in the way of that and gives symptoms that we as hospice professionals are trained to help try to mitigate. We can't make them all go away, but our goal is to help someone be comfortable and relaxed, family be knowledgeable and supported in the dying process, and for someone to do it at home, wherever they consider home to be. So that's our goal at Cooley Dickinson Hospice. There's nothing we do that hastens it. There's nothing that we do that prevents it. So as Attorney Hooker was talking about, things like the healthcare proxy really, really are important when you get to this part, and even beforehand. It is something that we actually ask people to try to get before they come on to hospice. You're going to need somebody to help you make your decisions. I would end with, it's completely okay to not understand every part of hospice. Don't try to absorb it all from one meeting or shaking hands with somebody who can talk about it. That's what we're here for. Hospice is very tailored to what you and your family needs at that time. So it's okay not to understand it completely. You can call us and we can answer any question that you have. In regards to veterans, the VA benefit fits nicely when you're using your Medicare benefit that covers hospice. Your VA benefit covers nicely. There are times with Medicare you can't be in two programs at once. You can be in a VA benefit and a Medicare benefit when it comes to hospice. So one thing specific about us is we are part of the We Honor Veterans program. We are working towards our level 5, and Steve and his team are our sponsors, I would say. So we go to them quite often for help, and they're always very accommodating to us. One of the programs that we have through our We Honor Veterans program is a veteran-to-veteran volunteer. So our folks that sign on to us that were veterans are asked, would you like a veteran volunteer? Some say no, some say yes, and then we are able to offer somebody who really understands what this person went through during their time in the service and get to talk about it. We are very veteran-centric in our care. Every time that we meet with somebody from any discipline, which includes nursing, social work, chaplain services, are trained to ask, do you want to talk about your time in the service? And they can say no or they can say yes. Not to worry about opening up a can of worms. We know what to do. So we're very proud of our relationship with veterans. We're very proud of being part of the We Honor Veterans program, and soon we'll be applying for our level 5. Which is the highest we can achieve. So thank you all. I'm over there. I have stress balls, which I've shared. Don't leave a mark if you throw them at somebody. So you will be safe. So thank you.
I needed a stress ball today before this event was happening. So many things were happening. I just want to say, one of the good things, if you want a long life, eat Hadley asparagus, because Helen, how old are you now? How old are you now? 103. Stanley? And Stanley, our World War II vet, is also 103, right? 103. Yeah. So eat your Hadley asparagus. One of the things I wanted to also make sure everybody knew, our office, 3 of us are all accredited with a national organization to do actual claims, VA paperwork, if you have a disabling condition like hearing loss, like that bad knee, like PTSD, any of the things that people, and I have put in benefits for men and women at 22 and at 92. One of the things that's really hard for me to hear veterans say is they will go without asking for anything because they're trying to save it for the next person who probably needs it more. I think that's incredibly chivalrous, but wrong-headed. And the reason I say that is anybody who knows how government works, they do a budget. And if there's a need, that budget is going to say, we got to put money there. If you don't ask for it, if you don't get what you deserve, you're making it harder for the next veteran coming along to get his benefits or her benefits, because the budget goes down. They say, well, that generation didn't need it, so why do we have to do it for the next? So when you think you're doing it and you're being chivalrous by not asking for it and saving it for the next guy, understand, come to us. We will help you file. You're making it easier for the younger veterans who are coming home today from their battles and their conditions. I just wanted to make sure you all knew that. So, thank you.